Thank you, ladies and gentlemen, for coming again to listen to me. I want to take this opportunity to respond to a question that one of my viewers has asked. She wanted to know why I was insisting on avoiding self-medication. And the viewer of my last video on the use of artemether-lumefantrine for treatment of malaria, and where I had insisted that people should avoid self-medication. Yes, I would want to say this, that drugs, as we know, are used either for treatment of disease, they are either used for prevention of disease, for mitigation of the effects of a disease, or also for diagnosis. And a perfect situation could be that when you are unwell, you find other means of alleviating a disease or a disease condition without necessarily using a drug. Unfortunately, it may not be possible that there is other ways or there are other means of preventing, treating, diagnosing, or rather mitigating the effects of a disease without necessarily using a drug. And that is to say, as much as drugs are good things, drugs are also bad. Drugs actually are poisons. So, the best option would be to reduce exposure to medication, and that is to say, only use it when you need it. And how do you verify that you need it? That is why I have been insisting that for any disease condition, you have to get direct prescription, or rather direct instructions from a qualified, competent health personnel, so that you are taking medication for a prescribed period of time and also you're following strict instructions. Just to remind you that overexposure to medication may even have a more harmful effect than a beneficial effect. Because remember, when we take medication, irrespective of the route, either orally or either through injection, through inserts, and through those other routes, when drugs get inside our body, they have also to get an exit route. And for them to get an exit route, drugs first of all have to be absorbed in our body system. They have to be metabolized and be converted in a product that is readily excretable until they are eliminated from the body. And you see, this entire process involves vital organs within our bodies. The kidneys involved, especially for excretion of medication from our bodies. That is through the process of urination. The liver is involved. Other very, very important organs inside our bodies are involved. And so, what happens is that these medications, while going through these processes, tend to have an impact or an effect on these organs. And so it would be prudent to reduce, or rather to avoid, use of this medication when you do not need them. And I would want to now address the question that the lady asked why I insisted not on the issue of self-medication. Remember, when we talk about self-medication, we are saying that you are using a drug to treat a condition that you yourself think or perceive to be suffering from. And that means you may not always be right. You may have signs and symptoms of malaria, but maybe you have typhoid, maybe you have brucella, maybe you have another disease condition that is not even malaria. And you keep on maybe using this malaria dose, and maybe you don't get well. You try another medication, use it, you don't get well. This is dangerous because by the time now you seek the intervention of an expert, maybe disease has progressed to a level that is worse. And the biggest or the worst thing about self-medication is the fact that your body is being exposed unnecessarily to medication. Actually, to be very precise, is being exposed to poison. So, what am I trying to say? Use medication when you need it. And how will you use it when you need it? Seek the advice of an expert, a health expert. So, I want to reiterate and say that self-medication should stop. It should stop, and stopping means that has to start with you. There are situations where you can do self-medication. In an instance whereby you are unwell and maybe accessing a health facility or a healthcare practitioner is not there, then you can engage in self-medication, because there we will say that you are trying to weigh the benefit against the risk. You are trying to say, now that I cannot get a malaria test to confirm whether I have malaria, maybe because I live kilometers away from the health facility, or because the facility is inaccessible, let me try to use this antimalarial drug as I look for alternative ways of getting healthcare service. So the bottom line is, stop from now and from today the issue of self-medication. This will help stop issues to do with drug resistance. Remember, currently some of the antibiotics that we're using in our country are not effective simply because of resistance. So I do not want you to be part of a contributing factor every time we talk about drug resistance. Those small things that you do, those actions that you do matter a lot. So I would want to take this chance and reiterate and insist that please don't use medication when you don't need it. Drugs are not food. drugs are poison. Thank you.